The detention system is on the verge of tipping into a crisis similar to the one that engulfed camps like Woomera during the Howard government, according to the head of a government advisory group on asylum seekers. Monash Professor of Psychiatry, Dr Louise Newman, chairs an independent expert health group advising the Immigration Department. She's also a member of a departmental committee monitoring the wellbeing of children in detention. She spoke with Late Line's Margot O'Neill, and a warning, this story contains some disturbing images.
Professor Louise Newman has been campaigning for better mental health services for asylum seekers for 10 years. Firstly, as an outsider during the Howard government, which she says oversaw a disastrous mental health crisis in detention camps like Woomera. Now she's worried it could happen all over again.
We're starting to see a repetition of some of the factors that produced the terrible rate of mental health problems we saw previously. We're certainly seeing increasing numbers of people presenting with distress, be that depression, symptoms of post-traumatic stress disorder, depending on where they've come from. We're seeing children with developmental problems. And I think this is particularly concerning, especially for those of us who've been around reviewing conditions in immigration detention and places of detention since 2000.
Now an advisor to the Immigration Department, Professor Newman says overcrowding in remote detention centres means mental health services aren't coping. She says the Expert Health Advisory Group has recommended the government consider releasing into the community the most at-risk asylum seekers, such as children and torture victims, so they can better access treatment.
We need to have a serious discussion about the necessity of keeping people with histories of torture and trauma, children and people with mental health problems actually in remote facilities. And it has been our advice that these individuals and family groups need to be on the mainland in community-based accommodation.
Professor Newman says the government's own research confirms the damaging effects of prolonged detention, especially on children.
Sadly, I'm and many other clinicians are still treating some of the children and their parents that we saw during those days, the darkest days of Woomera and Baxter. We know that unless we actually do something, we will have a repetition of some of the disastrous consequences of detention.
While there have been significant policy changes, she says recent election politicking over asylum seekers seems to have set back further reform.
I think what's deeply concerning is that a political process in many ways has stopped some of the goodwill and change that we would all like to see. We are at a crucial point of decision making. I think what's incumbent upon the new minister is to really examine this and show some political courage in tackling the issue.
Professor Newman says she'll reconvene a coalition of medical groups set up during the Howard government called the Health Alliance to consider further action. Margot O'Neill, Late Line.
A spokesman for the new Immigration Minister, Chris Bowen, says the minister has yet to read the recommendations of the advisory health group. He'll respond when he has time to make an assessment. Today was his first official day in his new portfolio.